Let me give a quick update on the cluster at Tan Tock Seng Hospital. The first case of the Tan Tock Seng Hospital cluster was confirmed on 28th of April. It was a staff nurse who developed an ARI symptoms that day. She dutifully reported her symptoms, and she was immediately tested, and despite the fact that she had completed a vaccination earlier in the year, she was confirmed to be COVID positive. I should point out that this does not mean that she is the first infected case and had brought COVID-19 into the wards. Investigation is still ongoing. But her responsible act enabled us to pick up the cluster at Tan Tock Seng Hospital. Our immediate priority in such situations has been to contain and isolate the infections so that they do not spread to the larger community. Hence, we immediately threw a containment ring around this first detected case, quarantining close contacts and testing everyone who could have been in contact with the individual. This included all staff and patients of the affected Ward 9D. By the next day, on 29th April, we had identified 3 staff and 6 patients of Ward 9D who were infected. One of these patients had started to display COVID-type pneumonia symptoms at this time too. As he had entered Ward 9D earlier, on 20th April, testing and quarantine was hence further extended to all staff who worked in Ward 9D from 20th April, as well as discharged and current inpatient and visitors to Ward 9D from 20th April. Testing was also expanded to include all inpatients and all staff working in the main ward block. After this first round of testing was completed, all other Tan Tock Seng staff were also screened. For additional precaution, patients and staff from the main ward block were also retested a second time. We then threw a larger ring around Tan Tock Seng Hospital, inviting discharged patients and visitors who were in the hospital during the affected period to also be tested. They are not close contacts and hence have a lower risk of infection, but we offer to test them for abundance of caution and to give them peace of mind. For every case detected, a large ring was drawn around them for testing and isolation, and we locked down all wards that had exposure to the infectious cases. In total, as of 10th of May 2021, close to 2,500 individuals have been quarantined. 12,500 individuals have been tested as part of the special testing operations. This is in addition to 12,000 staff, 1,000 patients, as well as those who have been quarantined. A total of 43 cases were confirmed, comprising 10 staff, 26 patients, and 7 visitors or household members. We will continue to monitor these individuals who have been exposed and retest them when necessary, as some of them may be incubating the infection. Of the 43 COVID-19 cases in the Tan Tock Seng cluster, 7 staff and 2 patients had received full doses of the COVID-19 vaccine. They were all either asymptomatic or only exhibited mild symptoms, and none of them required oxygen support. Of the 34 individuals who were not fully vaccinated, 6 required oxygen, 2 are in intensive care, and 1 had sadly passed away from COVID-19 complications. While the numbers are too small to draw firm conclusions, the findings do indicate that vaccination provides critical protection even against COVID-19 variants. We know that while vaccination does not eliminate the risk of infection totally, it does provide significant protection against infections and help to reduce the severity of the disease. It is also likely to reduce onward transmission. I therefore urge everyone to get vaccinated when it is offered to you and continue to comply with safe management measures even if you have been vaccinated. This will help to keep all of us safe. Tan Tock Seng Hospital has implemented a series of measures to prevent further spread within the hospital. Besides locking down the affected wards, Tan Tock Seng Hospital has also stopped all new admissions to the hospital, restricted visitors, and reinforced infection control, hand hygiene, and PPE compliance for all staff. Even while we were dealing with the cluster, work was also ongoing to understand the source and cause of the infection. Investigation is still ongoing and more will be shared when it is ready. We have also learned several important lessons. This particular B16172 strain appears very infectious, and there will be other variants just like this. Without vaccination, the infection among healthcare workers would have been much worse. While vaccine breakthroughs are possible, vaccines can help to prevent severe illnesses. Vaccines can also reduce the risk of further transmission, although the extent of which this is true is still being investigated. It is clear that vaccination is most effective when it is part of a whole suite of precautionary measures, such as mask wearing, safe distancing, accurate testing, thorough contact tracing, and timely isolation. I will talk more about vaccines later. Since the Tan Tock Seng Hospital cluster happened, there has been reports of healthcare workers there being shunned in public or refused services. I know this comes from a small minority of Singaporeans. The great majority is thankful for the sacrifices and contributions of our healthcare workers, including those from Tan Tock Seng Hospital. We know you have been working tirelessly in difficult and uncertain conditions. Despite the stressful situation caused by the outbreak, you continue to do your best to care for our patients. I believe I speak for the great majority of Singaporeans, all of us in the Ministry of Health, and everyone in this chamber, that we are all solidly behind you. So while we're in the midst of what appears to be a re-emergence of cases in our community, we are in a stronger position today compared to a year before. We know more about the virus, we have strengthened our healthcare system, built community care facilities, expanded our testing capacity, enhanced our contact tracing capability, introduced safe distancing measures, and embarked on vaccinating our population, which I will touch on next.